Hello everybody, I am Dr. Sunil Havannavar, Senior Consultant Internal Medicine, Manipal Hospital Sarjapur Road. What is the management of this disease and how to diagnose it? The most important diagnostic features are the clinical symptoms only. The type of rash, they usually appear on the hands, legs, face and even in the genital areas. So as I said, the rashes can be from the macule to the vesicles, different stages will be there. And if you ask your healthcare provider, they can easily see and diagnose it. In some cases we might need some secretions from the lesions to send to a particular lab to do the confirmatory diagnosis. Now what is the treatment? See, as it's a viral disease, it's a self-limiting. The most of the times no specific treatment is required. The treatment will be very symptomatic, like using the treatment for the fever, for rash, because these rashes are very painful and they are very itchy also. Sometimes we use antihistaminics, painkillers and some lotions so that the patient can be symptom free. Other important are isolation, avoid the contact with the other people, and lot of hydration, because patient should be hydrated well and patient should be symptom free. Now some patient ask me whether the patient needs antiviral medicines because it's a viral disease. In very rare and severe cases we use antiviral, otherwise antivirals are not recommended at all. Then what are the reasons for the death in these monkeypox cases? The death in monkeypox cases are very rare. For example, so African countries, even though there are 15,000 plus cases detected, the death was only 500 plus. So in India as such, there are no death from the monkeypox has been detected yet. So the cause of death are usually the complications, and the reason for the hospitalization is also complications. What are the complications? These are basically the sepsis, pneumonia and spread of this virus to brain, that's called as meningitis. If anything like this happens, then patient needs hospitalization. And like any other virus, this is the next most common question will be, do we have a vaccine for this monkeypox? Yes, there is a vaccine, but this vaccine is not available in India yet. There are 2 vaccines which are recommended in US. These vaccines can be given, but this vaccine is not for the mass vaccination yet. We don't need to give this vaccine to everybody. Then who do this vaccination for? This vaccine is basically for the people who are at the highest risk of getting the disease. People with multiple sex partners, sex workers, and those people who are working in the laboratories, and the people working in close contact with animals. These people will need vaccination at present. What the best can be done to prevent this disease? The best is to wash your hands, identify the person which has symptoms, and take the patient to the healthcare workers so that they can identify it early and treat accordingly. So the diagnosis is very clinical basically, and the treatment is very only supportive. So nothing to worry about. If you have any doubts about the monkeypox, you can come and ask your physician. Then they will help you. Thank you.